Hello, students. How are you? I hope that you are ready for this chapter. Chapter 13, the nervous system and psychological disorders. This is a toughie. Make sure you spend some time studying the nervous system. It's a little complicated, but luckily our book is, as you know, called the Quick and Easy, and just try to learn the material as it is in your textbook to help you with your exams. Alrighty, I like what the book says about the nervous system because it says, it has been said that the human body is more complex than the greatest computer. And right now we're all using computer. This class is 100% online. And computers, as you know, can be a little bit difficult. We've all had to learn how to use a computer. Well, when we talk about the nervous system, it tells you right there that it has been said that the human body is more complex than the greatest computer. So the nervous system keeps us in touch with both our internal and external environments. It is the manager of the body because it controls all of the systems. So I'm going to repeat that. It is the manager of the body because it controls all the systems, and we've learned lots of them already. The nervous system is made up of all the nerve cells in the body. This system takes in information through our senses, then it processes the information, and then it triggers a reaction. For example, to move your muscles or causing you to feel pain. So this is what the nervous system does. Takes in this information, you move a muscle, you feel pain. Serving as a control center and communication network, it stores and processes information. It stimulates movement and detects change. So we're going to learn lots about this particular chapter. And let's go ahead and go into our objectives. So we always know that we're going to learn the different terms that have to do with this particular chapter. We're going to hopefully, I'm hoping that you are writing flashcards, because you'll notice that you'll find that very beneficial as you move through the courses that you are taking in health technologies or in the future. We'll learn about pathologies, diagnostic terms. We'll name psychological disorders. We'll talk about mental health a little bit in this chapter. Surgical and therapeutic interventions. And once again, we want to make sure that we're spelling everything correctly by the use of our flashcards. Okay, so let's go ahead and move forward. The functions first. So the nervous system is going to affect both psychological and physiologic functions. So the study of behavior and the function and processes of the mind is called psychology, because we know that psycho means mind and logy means a study of. So we'll learn mento a little bit later in the psychological section of this, psycho means mind as well as mento. Physiologic means pertaining to physiology. So physio means nature. So here's the study of the processes and functions of the body. So the nervous system influences other body systems. For example, damage to the spinal nerves that supply nerve impulses to the diaphragm may result in respiratory arrest. We have sensory, we call those afferent receptors. They're also known as dendrites. What they do is they detect change that occurs inside and outside the body. So monitor changes such as changes in room temperature. Why is it that sometimes we feel cold, we feel hot? Because these sensory or afferent receptors are the ones that detect this change. And everything goes to the brain, and the brain says, oh, it's cold or it's hot. Other receptors monitor changes within the body, such as temperature, and conveys them to the brain, as I mentioned. Integrated functions create sensation. They produce thoughts and memories. and make decisions based on what is received from the sensory receptors. So the nervous system responds by sending motor, or we call those efferent signals, to the muscles, organs, and glands to cause an effect. So this is the functions of the nervous system, but let's learn a little bit more of some functions. So we have what's called a somatic nervous system. You have to make an effort to add or subtract numbers, but you breathe without having to think about it. So the part of the nervous system under conscious or voluntary control is called the somatic nervous system. Somato means body, okay, and then nervo or nerve means nerve. Neuro, nervo, all means nerve. So remember that somatic, we're talking about the body movement, okay? So when you are going to be taking an EKG class, if you take the EKG class here in Health Technologies, which is Health Tech 91, and the lab is 101F, you will notice in your EKG strip if your patient moves, because you'll have somatic interference or the body interference, because that's voluntary movement. The part of the nervous system that relates to involuntary or automatic body functions is called the autonomic nervous system. Auto meaning self. So some of the functions that we're talking about that fall in this category is breathing, because think of self, right? Breathing, sweating, and digestion. These things just happen automatically, but many nervous system functions are under our control. So both the autonomic nervous system and the somatic nervous system are subdivisions of what we call PNS, which stands for the peripheral nervous system. You'll notice moving forward, we may talk about CNS, which is central nervous system. We may talk about PNS, which is peripheral nervous system, and we'll be talking about those, especially the peripheral nervous system. We'll talk more about that in chapter 14, but just know the abbreviations are CNS and PNS, and these are the two major divisions of the nervous system. Okay, so let's move forward. Divisions of the nervous system. This is really a cool slide, and hopefully you understand the concept behind this particular slide. So divisions of the nervous system. The central nervous system is shown here in yellow, which is the brain and the spinal cord. The peripheral nervous system is shown in blue. So these are the nerves that take impulses away from and towards the central nervous system. So remember, central nervous system is the brain and the spinal cord. Okay, so we talk about CNS, that's what we're referring to. When we talk about PNS, we're talking about the cranial and spinal nerves. So note that the central and the peripheral nervous systems have somatic and autonomic components. So let's take a look here on this slide. Okay, very last column, stimulus. What's a stimulus? Ice. Okay, so what happens? You touch ice, the afferent nerves, those are the sensory nerves that we talked about earlier. So you hold ice in your hands. As you see there in the blue, afferent nerves, example, sensory nerves in hand. So they send that message to the somatic nervous system, which is voluntary. That nervous system, the somatic nervous system, will then send a message to the efferent nerves, which now are the motor nerves in the hand. And what happens? The response then will be that the hands moves away from the ice. Same thing, think of a stove. Many of us, maybe when we're little kids, put our hands on the stove, ouchie, ouchie. What happens? Same thing. The afferent nerves, sensory nerves of the hand, sends the message to the somatic nervous system because it's voluntary. Then sends a message to the efferent nerves, and we're going to remove our hands from the hot stove. Let's take a look at the autonomic nervous system. This is auto, this is self, okay? It's not voluntary. Fear is a stimulus. You're walking down this dark alley and you're a little bit nervous because a zombie's gonna jump out. The afferent nerves sense that fear, sends the message to the autonomic nervous system. The autonomic nervous system is going to do two things. We'll send the message to the afferent nerves, and we have what's called the sympathetic nervous system. That's the fight or flight. So what happens here? These afferent nerves from the sympathetic nervous system, the response, your heart and breathing rate increases. You know, because you're walking down this alley, your heart is racing, you're a little nervous. This is what the afferent nerves are doing. Not only that, but the afferent nerves also send messages to the parasympathetic nervous system. After the response will be heart and breathing rate returns to normal. After that fear has happened, then the parasympathetic nervous system takes over, and now it relaxes you, everything goes back to normal. So these are the divisions of the nervous system. It's important to know, to understand that, that once again, CNS is the brain and the spinal cord. The PNS, we're talking about cranial and spinal nerves and what they do. Everything, messages, the stimuli is always picked up and it's sent over to the brain. The brain's gonna say, oh, I'm afraid, or I feel cold. And then we move forward to what needs to happen next via the nervous system. So here are the two major divisions of the nervous system. They're the central nervous system, as I mentioned, CNS, and the PNS. The central nervous system, that's the control center. It includes the brain and the spinal cord. It receives impulses from throughout the body. It's going to process this information and then responds with an appropriate action. The PNS consists of various nerve processes that connect the brain and the spinal cord. And as I mentioned before, with receptors, muscles, and glands. The peripheral nervous system consists of nerves that carry impulses towards as well as away from the CNS, which is the central nervous system. And it allows the brain to detect sensations within and respond to sensations outside the body, you know, based on the information that it picked up. So it's like a message center, right? Okay. Oh boy, this is the main part of this whole nervous system here. So the nervous system is composed of two types of cells, the neurons. So the basic unit of the nervous system is the neurons. And then we have glia cells or neuroglias, which provide nutrients and oxygen to other neurons. Glia, by the way, means glue. We'll learn that a little bit later, because these cells, they bind and they support neurons. The two types of cells have different functions. So we want to know that the neurons is a nerve cell. It receives and sends electrical signals over long distances within the body. It's like a battery waiting to send a charge, okay? So note the cytoplasmic projections there. Those are action potentials. It's got a single axon and several dendrites that project from the cell body. Now, dendrites are sensory receptors. So they're listeners like antennas. Antennas, they listen. And these nerve impulses that transmit impulses to the cell body. So it listens and it sends nerve impulses, sends it to the cell body. They are the first to receive electrical or chemical stimuli. And the axon, as you see there, this long axon, will carry impulses away from the cell body to the neuromuscular junction, which is, you see, the site of communication between the neurons, muscles, and glands. So many axons, they're several feet. They're surrounded by a white fatty covering called the myelin sheath, which are fine protective tissues that insulate the nerve axons and promotes transmission of nerve impulses. So these fibers conduct nerve impulses faster than axons that lack the myelin sheath. And we'll see an example later on of what happens if there is myelin sheath that's lacking. Now, the outermost layer of this axon is called a neurolemma, as we see in this particular slide there. The node of Ranvier helps speed the transmission of impulses down the axon. Now, the nervous tissue is the neuroglia. It's composed of glial cells. Remember, glia meaning glue because they bind. These cells bind and support neurons. So their function is to preserve the electrical chemical balance of the nerve cells and to form the myelin sheath that's going to protect the neuron. These cells provide special support and protection. If glial cells are destroyed, they can replace themselves. However, if the axon is destroyed, it cannot be replaced. So this is very fragile, we have to be very careful. Let's see, and dendrites, as you see them there, they're thick extensions. They are like cables. So they're the listeners, the antennas that sends impulses to the cell body, and axion carries them away. So we want to remember that. Okay. So let's now learn some of the combining forms here for this particular chapter. And do keep in mind that this is a nice big chapter. So we're going to, learn a lot of stuff here. So auto, we know, means self. Like I mentioned, the autonomic nervous system. Cerebellum, we'll take a look at that. Cerebro and encephalo. So you have two combining forms that mean brain. So when you think of encephalo, En means inside, and cephalo means head. Don't confuse these two because cerebro and encephalo being both in brain, where cephalo is just the head, okay? We learned cervical, that's not a new word for us. Coccygeal also is not a new word, and cranial. So hopefully you remember these from past chapters. Now you know you're noticing that you are seeing a lot of repeats. Okay. Dendro, think of those dendrites, the cables, think of branches to the nerve there. They're the listeners, the antennas, if you will. Dura mater in German, that means tough mother. It's the outermost of the three meninges that we'll take a look at. Glio, remember we learned about neuroglia, or sticky substance like glue, so you'll want to know that. Lumbo, we learned about lumbar. Lower back, meningio for meninges. We'll take a look at those as well. And myelo, bone marrow or spinal cord. Okay, so here I said, remember, we know cycle means mind. We learned that. But mento also means mind. And nervo, nerve. Freno's a new combining form, mind or diaphragm. No, I think we learned that. We did learn that in the past. Physio for nature, like physiology for this chapter. And guess what? You know the rest of those. Ventriculo for the ventricles of the heart, but also in the brain. And we'll take a peek of those a little bit later there. So by now, I think you kind of know what to do with these pages that have the combining forms. You know that you need to make flashcards, and some of these are repeats, so maybe you are making a little bit less flashcards just because you have a flashcard already for some of these combining forms. Okay, so meninges. The brain is enclosed by three membranes. We call these meninges. The tough outer membrane, remember it was a German word, the dura mater, lies just inside the skull, supports large blood vessels of the brain, which transports nutrients to and from the heart. It's composed of primarily connective tissue called mater. This picture here is not showing, it's not giving the middle layer that we call arachnoid. It has a thread-like strand, and it's supposed to resemble spider web. So that's why it has a web-like appearance, but you can't really see it too well on the slide. If you Google meninges, you'll see a better picture that has a better picture of arachnoid and the spider, the web-like, spider web-like resemblance. The innermost meningeal layer, we call that the pia mater, and is so tightly bound to the brain that it cannot be removed from the brain without damaging the surface. It contains numerous blood vessels and lymphatics that nourish the underlying tissues. And there's the ventricles. We just learned ventriculo. There's the ventricles there of the brain. We just learned that combining form. So the locations of the meninges are particularly important in identifying the location of a hematoma of the brain. I have seen an autopsy, and I've seen them break the actual skull so that they can get down to the brain of the deceased individual, and they use a saw and they just crack it open. It's just amazing the way that happens. But we're going to see a slide a little bit later of different areas where you can get a hematoma. So remember these different layers of the brain. They are membranes. We see the skull, dura mater, arachnoid, pia. It tells us remember, you know what sub means, right? Below, arachnoid space. There is the CSF, the cerebral spinal fluid that we see in the brain, as well as in the spines of different areas of the actual brain there. So remember where the meninges are, because we'll see them a little bit later again. The brain is the most complicated part of the body. The brain and the spinal cord are encased in a bone, the skull and the spinal column. Different lobes of the brain are identified with speech, vision, movement of the body, and other functions. Additional protection and cushion from shocks that could cause injury to the brain and spinal cord is provided by the cerebral spinal fluid, CSF, and the meninges. The cerebrum, as we see here, or the brain, is about 7/8 of the total weight of the brain. It's the largest uppermost portion of the brain. It evaluates and controls all sensory and motor activities, like sensory perception, emotions, consciousness, memory, and voluntary movement. The cerebellum is inferior to the cerebrum. It's the second largest of the brain. It's responsible for voluntary movement, such as walking, controls balance. Injury here could lead to paralysis of arms and legs. We have here the brain stem, which consists of the midbrain, the pons, medulla oblongata, which the medulla controls breathing, coughing, swallowing, vomiting, sneezing, digestion. It is the pathway of impulses between the brain and the spinal cord. Diencephalon has two major parts. Remember, di means two, and cephalo means brain. So here we have the thalamus, which relays sensation of pain, pleasure, and the hypothalamus, it's the smaller than the thalamus. It controls the pituitary gland and helps regulate sleep, appetite, and emotion. So these are the different parts, or the principal structures, if you will, of the actual brain here. Let's move on to the different lobes of the brain, as we see here in this particular slide. So So each cerebral hemisphere is divided into 5 lobes: the frontal, occipital, temporal lobe, parietal lobe, and insula, that is covered by parts of other lobes. Now, perception and self-awareness are linked to the insula and tissue surrounding the largest portion of the brain. So insula is the 5th lobe of the brain, least known, seen only in a dissection. And it's just deep within the brain, that insula. So the frontal lobe, here is the functional center. Is personality, speech, reasoning, judgment, emotions, planning, and movement. The temporal lobe is where smell, hearing, balance, and coordination takes place. Parietal, which is the blue area, language area and sensation, and occipital, vision and ability to recognize objects. So we figure if there's any type of damage to a particular lobe, that particular function might not work. So these are the lobes of the brain. Spinal cord and emerging nerves. 31 pairs of nerves emerge from the spinal cord and are named and numbered as. So this brings back memories of chapter 6, which is our musculoskeletal, because we know that we had 7 cervical vertebrae. Well, guess what? Here are 7 cervical nerves, 12 thoracic nerves. We have 5 lumbar nerves, sacral nerves, and coccygeal nerves. So just like the musculoskeletal vertebrae, they're named the same, but instead of vertebrae, they are nerves. They carry impulses to the spinal cord and to muscles, organs, and glands. The adult spinal cord is about 44 centimeters long, and it extends down the vertebral canal, starting at the medulla down to the lumbar region. So 44 centimeters long, all the way down to the lumbar region there. And these are the nerves. Sometimes we'll bend down or we'll get a pinched nerve, and these are where they are. Okay, we get a quick quiz. All right, so go ahead and let's figure this one out. The question is, the 2 major divisions of the nervous systems are the A, autonomic and peripheral, B, central and peripheral, C, autonomic and central, and D, central and somatic. What is the answer? Okay, so if you said B, the 2 major divisions of the nervous system are central and peripheral. The autonomic nervous system is that part of the nervous system that relates to involuntary action, where the somatic nervous system is part of the nervous system under conscious control, because somatic means body, right, movement. The latter 2 are divisions of the peripheral nervous system. Okay, let's go ahead and move forward to some more terms here. Okay, so let's break down this first word here. Electroencephalography. Electro means electric, very good. Encephalo we know means brain. And graphy, the process of recording. So it's the recording and analysis of the electrical activity of the brain, because we have encephalo there. The record obtained is then an electroencephalogram, right? That's the record. The diagnosis of the brain death may require the electroencephalography to demonstrate the electrical activity of the brain is absent. Then we have electromyography. Myo, what does that mean? Muscle. It's the preparation, study, and interpretation of an electromyogram. which is a graphic record of the contractions of a muscle as a result of electrical stimulation. And then myelography. Myelo means bone marrow or spinal cord. Here is an X-ray inspection of the spinal cord by injection of a radio-opaque media. So they'll put media inside to take a look so they can see things a little bit better. Okay, so let's talk about diseases and disorders here. So CVA, that is called the cerebral vascular accident. Sometimes you'll see it as a TAC. CVA, stroke, or stroke syndrome. So here, normal blood supply to the brain has been disrupted. In a CVA, it results in insufficient oxygen to the brain tissue caused by hemorrhage, occlusion, which is closing, or constriction of blood vessels that normally supply oxygen to the brain. So here we might have paralysis, weakness, speech defect, and other complications, as well as death may occur. Some types of strokes are commonly preceded by warning signs such as transient ischemic attack. We call that a TIA, which is caused by a brief interruption in the cerebral blood flow. The term ischemic pertains to deficient blood circulation. TIA symptoms often include disturbance of normal vision, dizziness, weakness, and numbness. So disorders such as brain tumors that interfere with the flow of the cerebral spinal fluid causes hydrocephalus. Remember what hydro is, that's water. So it's fluid accumulation in the skull. The fluid accumulation is usually accompanied by increased intracranial pressure. You have fluid in the skull, now you have increased intracranial pressure. So when this happens in an infant, before the cranial bones fuse, the skull enlarges, and in an older child or adult, the pressure damages the soft brain tissue. So this is hydrocephalus. So I mentioned to not forget the meninges. So here we have 3 types of hematomas associated with head injuries. We have a subdural, epidural, and intracerebral hematomas. So in the epidural hematoma, what happens here is the blood will accumulate in the epidural space, the space outside the dura mater, the outermost and the toughest of the 3 meninges surrounding the brain and spinal cord. So accumulation of the blood beneath the dura mater is the subdural hematoma, and bleeding occurs within the brain in an intracerebral hematoma. So you see how important it is to know these prefixes because then you know exactly where this hematoma is, this bleeding that's going on. When we say intra, we know that means within. When we say sub, we know we're talking about below. And epi, then this is outside. Okay, all hematomas within the skull are serious and can result in compression of the brain, so are evacuated whenever possible. So we want to make sure that we get that taken care of. So here is the skull. We know it's nice and hard with the different areas showing the hematomas. My first jury duty case, I was there for 3 weeks, and it had to do with hematoma. Someone was kicked in the head, and they were, that was the case there. Okay, so an aneurysm. So this is a diagram of an aneurysm and the major cerebral arteries visible in a cerebral angiography. So a cerebral aneurysm is a localized dilation of a wall of a cerebral artery, which can lead to rupture and then you'll get a stroke that's causing hemorrhage. It may require a cerebral angiography for diagnosing. And we talked about aneurysm. You think of a balloon when it pops, this is kind of an aneurysm here. It's just it's danger. It's not good because you end up with a stroke here. And here they're showing you an aneurysm in the brain. Shows lateral branches of the middle cerebral artery. We can get blood clots in these areas as well. Showing you different arteries. And if they want to take a look here on an angiography, you see it says here towards the bottom, catheter with contrast media. Remember that a contrast media is for us to be able to take a look to see the part of the body much better. Okay, I always think that you can be the safest person on the road, and here comes someone else and causes the accident that you did not make happen here. So we have, fractures and dislocations of the vertebral column can result in injury to the spinal cord. And these types of vertebral injuries occur most often at points where a relatively mobile portion of the spine meets a relatively fixed segment. For example, we see a hyperflexion there of the cervical vertebrae. So person, maybe they had too much to drink, who knows, or wasn't paying attention. Maybe they were texting and now they hit a tree. So you see the anterior dislocation there. There's rupture of a ligament. And then you have damage to the spinal cord. We have to be careful with damages to the spinal cord because we might end up in a wheelchair. B is hyperextension of the cervical vertebrae. So now we were rear-ended. There's compression of the spinal cord and then ruptured now the anterior ligament instead of the posterior. Lastly, C is a vertical compression of the lumbar spine and the cervical spine. You fall down, maybe you were swimming and you hit the pool really hard. Now there's a compression fracture of the cervical spine, and you know where the cervical spine is. Fractures as well as excessive bending or extension of the spine. Spine, combining form for spine is spinal, can result in spinal cord injuries. So we have to be very, very careful in our activities because we really don't want to have any type of problems with our spinal cord because later on it causes problems. Okay, let's move on. Primary brain tumor. One that originated in the brain is shown in this particular photo. Most brain tumors have spread from another part of the body. We see here, there's a little arrow there that's showing us the brain tumor. Let's go ahead and review some diseases and disorders. So we know that A means no, kinesio means movement. So here we have, and then IA is pertaining to or condition, so complete or partial loss of muscle movement, akinesia. Bradykinesia, remember what Brady is? Brady means slow, so slow movement. Here we have an abnormal slowness of movement or sluggish of mental and physical processes. And hyper we know means excessive, so now abnormally increased activity or motor function. Anesthesia is not a new word for us, and meaning no, aesthesio meaning feeling, partial or complete loss of sensation with or without loss of consciousness and resulting from disease, injury, or administration of an anesthetic. We have to be really careful when we get an anesthetic that the doctor does not puncture any type of nerve that later on is going to give us loss of sensation. Okay, so here's all the kinesio words. Remember that means movement. Kinesio means movement. Now let's learn a new word here. Again, A means no. Phago means eat, so phagia. Here we have an inability or refusal to swallow. It's characterized by abstinence from eating because swallowing is painful. Aphasia, now aphasia means speech. So absence or impairment of the ability to communicate through speech, writing, or signs. It results from a brain dysfunction. Dys, we know, means difficult. Here we have speech impairment caused by a lesion in the brain. It's characterized by lack of coordination and failure to arrange words properly. So these are some diseases and some disorders that the brain has been injured somehow. Cephalo, we know, means head. What does algia mean? Remember algia and dynia? What do they mean? Pain. So pain here in the head. Next time you have a headache and you see the doctor, don't say I have a headache. Say I'm experiencing cephalalgia, right? Cephalalgia. Because it's cephalalgia. Cephalalgia or neuralgia, pain along the course of a nerve. Cerebral concussion, loss of consciousness, either temporary or prolonged as a result of a blow to the head. So consciousness have different grades of severity. There's grade 1, 2, 3, 4, and 5. So it goes from the mildest level of consciousness to a much longer period of unconsciousness. So there's different levels, or they're called grades, if you will, of concussions. Let's see. So we know contusion is a bruise. So we know the bruise is going to be on the brain tissue there, again, as a result of a brain or a head injury. Hemorrhage is pretty self-explanatory. Again, the result of a rupture or a sclerosed or a diseased blood vessel in the brain. Coma, a state of unconsciousness from which the patient cannot be aroused, even by powerful stimulation. So talking about a coma, they are a little bit on the state of unconsciousness. Diseases and disorders, remember D means two, plasias, paralysis. So now we have paralysis affecting like parts on both sides of the body. Hemi, half, paralysis of one side of the body. And para, near or beside. So it'd be paralysis of the legs and lower part of the body. Quadri, remember that means four. So now you have paralysis of your four extremities, but what else was four? There was another prefix, you remember? Tetra. Tetraplegia, normally you hear quadriplegia, but just know that tetra means four as well. All right, you have a quick quiz. Here we go. What is kinesio? That was a combining form. So akinesia is A, abnormal slowness of the body, B, abnormal increased activity or motor function, and C, complete partial loss of muscle movement, or D, pain along the course of a nerve. Take a few minutes and tell me what that is. Okay, so if you said C, you are correct. Akinesia is complete or partial loss of muscle movement. Bradykinesia is abnormal slowness of the movement. And of course, hyper is the abnormal increase. Neuralgia is pain along the course of a nerve. So the correct answer is C. Okay, so cerebral palsy is a brain disorder that's characterized by paralysis and lack of muscle coordination. It results from development defect in the brain or trauma at birth. Myasthenia gravis, we learned about that a little while back. Myo meaning muscle, asthenia meaning weakness. So here we have a disease that's characterized by muscle weakness and abnormal fatigue. Epilepsy, lepsy meaning seizure, a group of neurologic disorders that's characterized by recurrent episodes of convulsive seizures, sensory disturbance, loss of consciousness, or all of these. An uncontrolled electrical discharge from the nerve cells of the cerebral cortex is common to all types of epilepsy. So here we have an EEG, electroencephalogram, which shows the normal activity versus seizure activity. And you see the seizure there a little bit more active, and then the normal, which is not active. A meningeal seal, which is a herniation of the meninges through a defect in the skull or the vertebral column, occurs in embryo when the fusion of the spinal cord is incomplete. So partial paralysis from that point downward is possible, as are problems with bladder and bowel control. The spinal meninges have formed a hernial cyst that is filled with cerebral spinal fluid, and it's protruding through a defect in this vertebral column. You could have a cranial seal, so you have protrusion of the brain through a defect in the skull, or encephalocele, which is a hernial protrusion of brain substance through a congenital or traumatic opening of the skull in cranial seal. Okay, multiple sclerosis. We've heard about that here and there. So remember that sclero means hard, osis condition. So multiple sclerosis is a chronic disease of the central nervous system in which there is a progressive destruction of the myelin sheath of the neurons. Remember the myelin sheath there? You see a little bit missing right below the cell body at the beginning of the axon. It affects your brain, spinal cord, and the optic nerves in your eye. So multiple sclerosis happens when your immune system attacks the fatty material that we call the myelin. We talked about that in the neuron a little bit earlier. This wraps around, the myelin sheath wraps around the nerve fibers to protect them. So without this outer shell, your nerves become damaged. This damage means your brain cannot send signals through your body correctly. Your nerves do not work as they should to help you move and feel. So symptoms would be trouble walking, feeling tired, maybe muscle weakness, blurred vision, numbness, tingling, just to name a few. Medication and physical therapy can ease or control symptoms, but currently there is no cure for this disease. We call this multiple sclerosis. And you see a little bit of the myelin sheath that's missing there throughout, and this is the problem. Parkinson's disease, Michael J. Fox? Yes, he has Parkinson's disease, which is a progressive impairment or deterioration of the neurons, which are the nerve cells, and is characterized by a fine, slow, spreading tremor, muscular weakness, rigidity, and often this peculiar gait, which is a walk. Lack of dopamine, which is a chemical messenger, which the brain produces, and this is the problem, they lack dopamine. And if you know who Michael J. Fox is, he's, what was that movie, Back to the Future. He was popular there. He's still in some movies, but you always notice he has his hand in his pocket because of the tremors there. But this is Parkinson's disease, a degenerative neurological disorder. Okay, let's move on here. Okay, diseases, these are a lot of itis, class. By now, you know what this means. And a lot of, let's see. So of course, meningitis, the inflammation of the meninges, all these itis, inflammation of the brain and the meninges. Remember what malacia means? Malacia, remember that? Softening, so here we have softening of the brain. What is pathy? What suffix? What does that mean? Pathy. Disease of the brain or the nerves. Narcolepsy. Narco means sleep. It's a chronic ailment involving sudden attacks of sleep that occur at intervals, even driving. So someone that has narcolepsy, you could be talking to them and they just fall asleep. They just fall asleep. It's a sudden attack of sleep and it happens just whenever. Shingles, herpes zoster, an acute infectious eruption of vesicles, usually on the trunk of the body along a peripheral nerve. So this is an adult form of chickenpox, herpes zoster. Now there is a shot called Zostavax that helps in some of our older population get that shot, and they do not get shingles because it's very painful and very uncomfortable. All right, here you have a quick quiz, so take a few moments. Myasthenia gravis, so what is it? A, B, C, or D? All right, so myo means muscle, so it would be A. Muscle weakness and abnormal fatigue, multiple sclerosis. Remember, we have a chronic disease of the central nervous system. Here we have progressive destruction of the myelin sheath of the neurons. Narcolepsy, sudden attacks of sleep, and it occur in different intervals. And a chronic disease of the inner ear. We're going to learn that in chapter 14, so that will be next. Meniere's disease. Okay, so great. Let's move on. So now let's learn some psychological disorders, some word parts that have to do with psychological disorders here. We talked about arachnio, the space that kind of looked like a spider web, if you will. Claustrophobia, these are a lot of phobias. Put phobia behind a lot of these. So arachnophobia, people are afraid of spiders. Claustrophobia, barrier or closed spaces. Pseudophobia. We have phobia of false things. Let's see, what else do we have here? Zoo, so animals, these are all phobias. Agora, marketplace. Asthenia, we just learned about myasthenia gravis. We learned about, so dyslexia, words or phrases. So someone that has dyslexia, you know, they kind of read opposite instead of as we read from left to right, they kind of, they have problems with word phrases, the inability to read, spell, and write words despite the ability to see and recognize letters. So they have a little bit of problem with the ability to read and spell and write words. We know about anorexia nervosa. There it is. We're seeing it again because that is a psychological issue. All right, so let's move on here. Excuse me. All right, so let's talk about medical health here, mental health here, psychological disorders. So according to the National Institute of Mental Health, approximately 26% of Americans are diagnosed with a mental disorder each year. That is just over 1/4 of the population. Therefore, in healthcare field, the language of mental health, it's important when working with people from all walks of life and all different circumstances. Mental health concerns the mind, and the mind involves more than just the brain. Assessing a patient's mental health requires examining a variety of factors in patient's life. So in simple terms, the term mental health describes a disease-free level of cognitive and emotional well-being. However, mental health or mental well-being is much more than that. It is the result of striking a balance in all dominions or dimensions of our lives: biological, psychological, socioeconomic, spiritual, and environmental. When these are balanced, we are able to mentally function at a higher level. This leaves us free to be trusting, loving, creative, and our self-esteem is intact. So mental health also includes the ability to enjoy life. A state of mental health is hard to achieve and maintain in our complicated lives. It is very possible that over a lifetime, we will slip away from an optimal mental health and then retain it several times throughout. So crises, illness, and other difficult situations can affect our state of mental health. So here we have, psychological disorders are unlike most diseases or disorders because they are often, there's no change in the body structure and sometimes not even detectable changes in chemistry, making the abnormality difficult to demonstrate and treat in the usual sense. So when we talk about psychosomatic, we're talking about psycho meaning mind. Remember that somato means body and it pertaining to. So means pertaining to the mind-body relationship or having body symptoms of emotional origin. There is a manual that we call the DSM. It's used by experts for the diagnosis of recognized mental disorders in the United States. It's published by the American Psychological Association, and this manual provides descriptions, statistics, and identifies effects of treatment and others common treatment approaches for clinicians and psychiatrists. And these references are frequently used in healthcare, and you should at least be familiar with them. Okay, and then when we talk about, of the many classifications of psychiatric disorders, the most serious form, a psychosis, is psychosis, which refers to a major mental disorder in which contact with reality is lost and often characterized by feeling distress, anxiety that impairs normal behavior. Symptoms may include hallucinations, which are false sensory perceptions. They can have delusions, which are false beliefs and strange behavior. So schizophrenic is characterized by hallucinations, disturbance of language and communication, and disorganized or catatonic behavior. Neurosis is the former name for a category of mental disorders in which symptoms are distressing, reality testing is intact, behavior does not violate gross social norms, and there is no apparent or organic cause. Example, a child who's overprotective parents, always warning him of germs, may develop later a fear of things like public restrooms or touching doorknobs or phones, which nowadays we really have to be very careful, but maybe not to the point where you're just, freaking out, having a neurosis type situation there. Okay, so let's go ahead and move on and talk about some psychological disorders. Alrighty, so autism is characterized by withdrawal. They absorb themselves in fantasy and impaired social interactions, and communication is difficult. Persons with attention deficit disorder and attention deficit hyperactivity disorder demonstrate short attention spans, controlling behavior, and poor concentration. They are unable to concentrate on a task with this condition. In ADHD, hyperactivity, hyperkinesia, they all mean above normal amounts of movement here. So they're just busy, moving around, can't sit still. Okay, a couple more. Okay, so psychological disorders display observable physical changes in the brain here. So let's go to Alzheimer's here. A type of age-associated dementia is caused by small lesions that develop in the cerebral cortex. This disease is characterized by progressive mental deterioration with several characteristics, including confusion, memory failure, disorientation, restlessness, and inability to carry out purposeful movement. These symptoms worsen with age. Dementia now is a broad name that refers to a cognitive defect, a problem in the brain, difficult to remember, to learn, to communicate, eventually difficult to take care of oneself. It will affect mood and personality. And mental retardation, you know, if there's problems in the mind, and pretty much self-explanatory there. Anxiety is an anticipation of impending danger and dread. A permanent state of nervousness, worry, and apprehension can lead to depression. PTSD is an acute emotional response because maybe of a traumatic event or a situation involving severe emotional stress. A panic attack is an episode of an acute anxiety that occurs unpredictably. In class, if we were in class, we would be taking our exams on a Scantron, and I remember going throughout the class, and students already had their Scantrons out ready for the test, because that's something that you would be required to provide. And I went up to, and then I was passing the exams out, and I came to this young lady, and I said to her, "Where is your Scantron?" Because she did not have it. And she went into an episode of panic attack with acute anxiety, and she just freaked out. I would have given her a Scantron, but just asking her, "Where's your Scantron?" she just freaked out and she fell on the floor. And luckily, she had her backpack on the floor, and her head fell and hit the backpack. And so I had the ambulance come in and take care of her. But it was just amazing, though, while she was going through this, the students just continued taking their tests and gave me an opportunity to spend quality time with this student and take care of her, making sure she was okay. So a panic attack is an episode of acute anxiety that just occurs unpredictably here. Let's see, OCD, it's characterized by recurrent and persistent thoughts, ideas, and feelings sufficient to cause distress or to interfere with activities of daily living. A compulsion is an irresistible, repetitive impulse to act contrary to one's standards. An obsession is a persistent thought or idea. So these are psychological disorders. Now let's move on to a couple more. Okay, in dissociation disorders, there are 4 primary types. Emotions are so repressed, there may be confusion in identity and a split or separation of personality. I had a student one time that wanted to referred by they. And obviously there was definitely an identity or a split separation of personality. Some days she would look dress like a male. Some days she would dress like a female. And we were to refer to this individual as a they. In antisocial behavior, acts against the rights of others or contrary to societal standards. In paranoia, there are persistent delusions of persecution they're accompanied by distrust and their combativeness. Somatoform disorders are characterized by symptoms suggesting physical illness or disease, which cannot be demonstrated. Hypochondriasis includes an unrealistic interpretation of a physical symptoms despite evidence to the contrary. Pseudoplasia is a loss of muscle power without actual neurological paralysis. Neurasthenia, a nervous disorder, is characterized by weakness and sometimes nervous exhaustion. It's believed by some to be psychosomatic, although it's often associated with a depressed state. It's kind of hard sometimes when people are depressed, they act a little bit different. It's really hard sometimes to diagnose exactly what it is that they have. So here are our phobias. We kind of talked about them a little bit earlier. A phobia is a persistent, irrational, intense fear of something specific, such as fear of fires, inactivity, meeting strangers, or leaving the familiar settings of the home. So in agoraphobia, we have an intense, irrational fear of open spaces, fear of being alone or being in public places where escape would be difficult or help might be unavailable. We have the acrophobia, which is heights, and of course pyro is fire, zoophobia is animals, photophobia is fear of phobias, and then of course the arachnophobia would be spiders. And spiders are pretty scary looking. I would have to say so myself. I'm not afraid of them, but they're not the prettiest little thing around. All right, sexual disorders. Here we have sexual dysfunction, sexual perversion, paraphilia. Here there's a decrease or disturbance in a sexual desire in sexual dysfunction. Paraphilia is a sexual deviation or perversion, expression of biological, undesirable, socially prohibited, or unacceptable instincts or deviations. We know that anorexia is, and without anorexia is appetite. So anorexia nervosa is an eating disorder that's primarily seen in adolescent girls, and it's usually associated with emotional stress or conflict such as anxiety, irritation, anger, and fear. It is characterized by a prolonged refusal to eat, resulting in wasting, emotional disturbance concerning body image, and fear of becoming obese. So this is, you just think you're heavy, you don't want to eat, it's stress, you're stressed out. So this is an emotional thing that's seen mostly in adolescent girls. And then bulimia, a desire for a lot of food, then you want to make yourself throw up. Purging and depression can cause this. So pretty scary, because when you throw up, you have all the acids in your stomach that are going to come up, and you end up with problems in the esophagus. You end up with bad teeth because of all the acid there that is eating up your gums there. So you have to be very careful with these disorders. Okay, mood disorders are characterized by disturbance of mood as the main feature. So in clinical depression, it's usually an emotional state with exaggerated feelings of sadness, despair, discouragement, and emptiness, hopefulness. Mania is an unstable emotional state that includes excessive excitement, elation, ideas, and psychomotor activities. So in megalomania, individuals believe they are a person of great importance, power, fame, or wealth. In pyromania, there is an excessive preoccupation with fire. Kleptomania, there is uncontrollable urge to steal. You don't want to hang out with those kind of people there. Bipolar mental disorder that causes periods of depression and elevated moods. So people are bipolar, they're depressed, then they're elevated moods, they're kind of up and down. So these are all type of psychological disorders. All right, so let's move on here. Okay, so there's a variety of medication to help influence the mind. Psychotherapy treats disorders of the mind by psychological means. So there's definitely therapeutic interventions for those that are experiencing a difficult time that's affecting their mind. Surgical and therapeutic interventions. Remember, TOMI would be incision. So now we have a surgical opening of the skull, or portion of the skull, plasty, surgical repair, raphe, suture, suturing of a cut nerve. Remember that lysis means destruction. So here it's important to remember our suffixes. All right, here's a few minutes. Take a few minutes. Obsessive compulsive disorder, what is it? A, B, C, or D? Is it a phobia? Is it psychosis? Is it a panic attack or an anxiety disorder? What is obsessive compulsive disorder? If you said D, you are correct. It's an obsessive, it's an anxiety disorder. A phobia is an irrational, intense fear of something. Psychosis is a major disorder characterized by gross impairment in reality testing. And then panic attacks are another form of anxiety disorder. And that's a little quick quiz there. We saw ventriculus of the heart, of the head, ventricular peritoneal shunt. Shunts are tubes or implants used to redirect cerebral spinal fluid. We call that CSF, from one area to another. So in ventricular peritoneal shunts, they drain excessive CSF from a cerebral ventricle to the peritoneum. This type of shunt consists of a plastic tubing between a cerebral ventricle and the peritoneum to drain, again, excessive cerebral spinal fluid from the brain in a person that has hydrocephalus. Remember, that would be water in the head. The ventricles of the brain are the four main cavities within it. They connect to the canal of the spinal cord and they are filled with CSF. And CSF, once again, stands for cerebral spinal fluid, is a clear, colorless liquid that circulates in the ventricles and the space around the brain and spinal cord. It provides lubrication for the brain, the spinal cord, and accompanying bones. It is a protective cushion, transports hormones, magnesium, sodium, etc. And it provides chemical, stable environment for the brain and spinal cord. So cleansing carries waste materials like drugs away from the brain. Communicative chemical messengers also communicates chemical messengers or messages to the CNS, central nervous system. So here's a shunt. We want to get rid of all that CSF in the brain there. All right, so nowadays you can buy a TENS unit at Amazon, and this stands for trans, remember, across, cutaneous, remember that skin. So it's a transcutaneous electrical nerve stimulation. We call this a TENS unit. It's a method of pain control by the application of electrical impulses to the nerve endings. Pain signals to the brains are blocked by the electrical impulses generated by the stimulator that is attached to the electrodes placed on the skin. So again, pain signals to the brains are blocked. TENS is a non-addictive and has no side effects, but it is contraindicated in patients with artificial cardiac pacemakers. So if you have a pacemaker, you cannot use a TENS unit. All right, let's go ahead and talk about this right here. So this is the stereotactic radiosurgery. It involves a closed skull destruction of a target using ionizing radiation while the patient's head is held in a frame. So in the left side A, we see a stereotactic frame. It holds the patient's head in a fixed position. So this might be kind of tough if you are claustrophobic, right? Because you can't sit still, you can't move your head. In B, there is a gamma knife treatment. A high dose of radiation is delivered to the precisely targeted tumor tissue. So it's kind of cool the way that works. Trying to use ionizing radiation while the patient is being still there, seeing if they can target that tumor tissue. All right, so pain management may be for a short time, for example, after surgery, or longer as in a chronic pain. So what is the purpose of analgesics? They relieve pain without causing loss of consciousness, like maybe a narcotic. So a nerve block temporarily will block transmission of nerve impulses. Hypnotics are drugs often used as sedatives to produce a calming effect. And then, of course, anti-convulsive. We know that anti is against, so against convulsion. So if you're epileptic, you might be using an anti-convulsive. So we have a couple of slides here that have acronyms and abbreviations. ADD stands for what? Attention deficit disorder. Then we have attention deficit hyperactivity disorder. We have central nervous system, cerebral spinal fluid. We have cerebral vascular accident. Sometimes it's costovertebral angle as well. And then lastly, remember DSM, we have the manual that we talked about that had the diagnostic words for mental health. We have OCD, which is also a psychological disorder. We have PNS, peripheral nervous system. We have our TENS unit and TIA, transient ischemic attack. So we have acronyms, abbreviations, review them. You never know when they're going to show up. And this concludes chapter 13. Have a great day, class.